I can fan myself with all my information I have for antibiotics. We have 2 different charts, so we're going to have a lot of information. Okay, let's just dive right in. First one we're going to talk about are sulfonamides. These drugs end in azole or zine, however you say it, doesn't really matter. These drugs are bacteriostatic, which means they suppress the bacteria so that the patient's own immune system can clean it up. Just a thing for you to know. It's broad spectrum, and it prevents bacterial synthesis of folic acid, and this drug is concentrated in the kidneys. So since it's concentrated in the kidneys, it can be used for a UTI. It can also be used for upper respiratory infections, HIV, MRSA prophylaxis, which colonizes in the nasal passageways. Just one thing for you to know about MRSA. For these drugs, you do need to assess your patients for a sulfa allergy, and you need to also assess them for any signs and symptoms of infections. Just kind of know what you're dealing with here. Note for these drugs that resistance can happen. I mean, just kind of across the board with the antibiotics. So in order to help prevent resistance, which essentially is meaning that the bacteria gets smart and knows that, oh, we're trying to kill it with another drug, you need to teach your patients to complete the course of antibiotics. So if the doctor says, hey, here's 10-day prescription for an antibiotic, and the patient starts feeling better at like day 3, you need to say, hey, I get that you're feeling better. Don't save it for later. To finish this whole course of antibiotics, because the antibiotic is killing off the weak bacteria at like day 1, day 2, day 3. But by day 8, day 9, that super bacteria is like still alive. You want to get to day 9, day 10 to kill that super bacteria. So tell your patients to complete the course of antibiotic and to not share their antibiotics with other people. I mean, I can't tell you how many times people are like, well, I had some amoxicillin left over from when my daughter had her ear infection, so I just took that. It's like, come on now, you shouldn't be doing that. That's just for all antibiotics. I have it written right here under the sulfonamides, but just across the board for all antibiotics, remember that. Okay, nursing implications specifically for sulfonamides is that you need to make sure your patient does not have a sulfa drug allergy, and you need to force fluids, especially if your patient has a UTI, to help I don't even know exactly what it does, but I mean, it's helping your patient get better. But you don't want to force fluids you don't want to force fluids if your patient has heart failure, congestive heart failure, and they're on a fluid restriction. So just a thing to know. This drug can also cause photosensitivity, so you need to tell your patient to either avoid the sun or wear sunscreen, and because there is an increased risk of sunburn. And it's dangerous with sulfonylureas, which can be of concern for a patient who is diabetic. And all antibiotics patients need to use an alternative form of contraception, because the antibiotic is going to make the contraceptive not as effective. Adverse effects for sulfonamides are nausea and vomiting and abdominal pain, but they can lessen the abdominal pain by taking this medicine with food. And the 2 drugs here are sulfamethoxazole and trimexazole, which is the combination of that drug with trimethoprim. I can never say these drug names. Those are the 2 drug names. So this drug right here, when it's combined with this drug right here, equals the drug name right there. I don't know if I'm never saying these drug names right. It's okay. I'm not going to be a drug salesperson. Thank goodness. Okay, next category, penicillin. Pretty easy. The last portion of the name, the suffix, is -cillin. So, I mean, if you don't get that, you need to go back to kindergarten or something. It's bactericidal, which means it inhibits the cell wall synthesis. Remember over here, bacteriostatic, it suppresses the bacteria so the patient's own immune system can clean it up. This actually inhibits the cell wall synthesis of the bacteria itself. These drugs can be combined with other drugs, which will make them stronger. Nursing implications are that you need to monitor for allergy, typically 20 to 30 minutes after administration. Take with water. Don't take it with fruit juice because it nullifies the antibiotic's effects. And it's typically administered IM into a large muscle, and you want to rotate injection sites. Adverse effects include nausea, vomiting, diarrhea, anemia, rash, and pruritus. And the 3 drugs are ampicillin, amoxicillin, and piperacillin. These 2 drugs, Ampicillin and piperacillin are IV, and amoxicillin is oral. If you were a little kid in the 90s and you had an ear infection, you most likely got this bottle of pink medicine that tasted really good and was in your fridge. That's amoxicillin. I don't know if they still make it pink, but that stuff was good and made you feel better. So the next category are cephalosporins. The prefix here is cepha, or cepha. So CEF, CEFA, or CEPHA. Very original. But hey, I like it because it goes along with cephalosporin. Like penicillin goes along with psyllin. So it's bactericidal. It's going to interfere with the cell wall synthesis of the bacteria. There is a potential cross-sensitivity to penicillin, so you need to assess if your patient has a penicillin allergy. And obviously, if they have a penicillin allergy, you're not going to give them penicillin. There are several different generations. Typically, the older generation, so like generation 1, won't work as great, but it's going to be cheaper. And the newer generations, like generations 2 and generations 3, will be more expensive, but they're going to work better. So we have 3 different generations here. Generation 1 primarily works for gram-positive, and it's a prophylaxis for gram-positive bacteria, and it's a prophylaxis for staph infections. The drug names are cephalosporin and cephalexin, which are available IV and oral. The second generation is going to work for gram-positive and gram-negative bacteria, and it's a prophylaxis for abdominal surgery because it kills intestinal bacteria. And the drug here is cefoxitin. I'm probably not saying that right, but whatever. And the third category, or the third generation, I should say, is gram-negative bacteria. This is long-acting, and it can pass the blood-brain barrier in the brain. So this can be used for meningitis. And the drug here is cefotriaxone. I hope I said that right. The adverse effects are going to be the same as penicillin. Nursing implications here are that the patient can take this with food. They need to complete the course of antibiotic, and they should not drink alcohol, and they need to use another alternative form of birth control or oral contraceptive. The next category here is carbapenems, and the suffix here is penem, which is so great because it's so easy to remember that. It's bactericidal. Remember, bactericidal inhibits the cell wall synthesis of the bacteria. And this is the broadest category of antibiotics. And there is an increased risk of seizures, but it's more common in the elderly and renal impaired because they can't excrete the drug as well. This can be used for bone, skin, joint, and soft tissue infections. And the drugs here are imipenem, remember there's penem, and cilastatin, and meropenem. So imipenem works better together with that cilastatin, and meropenem has less seizure potential. So hopefully you can see how to spell those drug names right there. And then here for the cephalosporins, here are the drug names. They're all underlined. So you'll be able to you'll know how to spell those. So that's the first card we have for antibiotics. Remember, we have sulfonamides, penicillins, cephalosporins, and carbapenems. All sulfonamides, they end in azole or zine, however you say it. Penicillins end in psyllin. Cephalosporins begin with cepha, or cepha, and carbapenems end in penem. So that's the first card that we have. And now we have another card. So exciting. I love cardboard. Woo! Okay, this has 5 categories. Well, 4 categories and then a miscellaneous category, but we're just going to say that that's one category. It's going to be miscellaneous. So the first category over here is macrolide, and these drugs end in mycin, O-M-Y-C-I-N. These are bacteriostatic or bactericidal in higher concentrations. So remember that. There are 3 drugs. There's erythromycin, azithromycin, and clarithromycin. Remember, they all end in mycin. Erythromycin can be used for the respiratory tract infections, GI issues, and any skin infections. This drug stimulates GI motility, so it can especially be used for patients who are experiencing gastroparesis, which is like the paralyzation of your stomach or your gastrointestinal tract. So it's good for that. Good thing to know. These 2 drugs, azithromycin and clarithromycin, are more widely used because they do have fewer adverse effects than erythromycin. So erythromycin is kind of limited in its use now. So azithromycin can be used for GU issues, respiratory issues, and MAC. And clarithromycin can be used in GU issues, respiratory tract infections, MAC, and H. pylori, which are the stomach ulcer bacteria. Adverse effects include GI issues, nausea and vomiting, diarrhea, hepatotoxicity, flatulence, jaundice, and anemia. And nursing implications are that these drugs are highly protein bound, so you need to look for warfarin if your patient is taking warfarin, because warfarin is also highly protein bound. These drugs you do not want to give with fruit juice, and it's better if the patient is able to take this drug while on an empty stomach. The drug is just going to work better. The next category are tetracycline, and it's going to end in cycline. I love it when the drugs do that. It just makes your life so much easier. These drugs are bacteriostatic, especially for gram-positive and gram-negative bacteria, so A-okay there. The drug names are doxycycline and tigacycline, and tigacycline brand name is Tigasil, and it's IV only. So that's how you spell those drugs. And then here are the macrolides over here, how you spell those. So back to the tetracyclines. These are for acne, chlamydia, mycoplasma, pneumonia, rickets, or H. pylori bacteria. Adverse effects include photosensitivity. It alters the GI and the vaginal flora and tooth discoloration. Nursing implications is that your patients cannot take this drug with dairy, with antacids, with an iron supplement. It cannot be given to children under 8. It cannot be given to pregnant or lactating women. And patients should use sunscreen because of photosensitivity and an alternate contraception while taking this drug. And ideally, they would take this drug with food or water to help decrease GI issues. Aminoglycosides, and in CIN, bactericidal for gram-negative bacteria. The drugs here are gentamicin, tobramycin, and amikacin. I hope I said that correctly. Gentamicin is the most common. Tobramycin is for pulmonary infections. And then for infections that are resistant to both gentamicin or tobramycin, they can take amikacin. I hope I'm saying that right. Adverse effects include hearing loss, tinnitus, and dizziness. That's going to be in your ear region. And then in your kidneys, they can cause increased bun levels, increased creatinine levels, and decreased renal function. And another adverse effects is that CT scans with contrast may not be possible while the patient is taking this drug. A way that you can remember this, and our teacher talked about this, is that aminoglycoside is that it's a mean old glycoside. So you need to monitor ears and kidneys. So like the glycoside is just so mean and so old that it's going to affect ears and kidneys. I guess you could say my kidneys are down there, but whatever. Next category are quinolines. They end in fluoxin, and these are bactericidal. I'm going to hold it up so you can see how to say them. Ciprofloxacin and levofloxacin. Levofloxacin is the most widely used. Adverse effects are going to be in a prolonged QT interval, which could mean that the patient could throw a clot. So you need to monitor patients who have an AFib or who are clot prone. Other adverse effects include seizures, and it interacts with antacids, iron, and zinc. And there is a black box warning for quinolones, which can lead to tendon rupture or tendinitis, typically tissue injury on weight-bearing joints. So my friend and I were talking in class, and we came up with the idea of that I need to quit tennis because it ruptured my tendon. So we just were thinking of something stupid because it's just going to help us remember that. Quinolones, you have to quit tennis because it's going to rupture your tendon. So it's stupid, but it's helping us, so we're fine. The next category is just a bunch of different drugs that kind of don't have a home other places, so we put them all together, and they're now family. Clindamycin, this drug can be either bactericidal or bacteriostatic, and an adverse effect of clindamycin is pseudomembranous colitis. However you say that, I don't know. That's the adverse effect of it. I hope you can see the words. I cannot say it correctly. Linezolid, this is for hospital-acquired pneumonia, VRE, or MRSA skin infections, and patients need to avoid tyramine-containing foods, which can increase their blood pressure. Nitrofurantoin, which disrupts cell wall formation. This is for UTIs, and it does have an adverse effects of fatal hepatotoxicity, but that's rare. And it's really great if the patient can stay well hydrated on this drug. They'll really tolerate this drug well. Vancomycin is bactericidal. It's not for gram-negative drugs. It's for C. diff, so oral C. diff. Adverse effects can be toxicity to the ear, kidney, and a rapid infusion of this can lead to like really horrible hypotension or red man syndrome. And you need to monitor the IV site for a patient who's receiving vancomycin because it can lead to extravasation and destroy tissue around the IV site. So those are the last categories we have for antibiotics. There were a lot. I mean, we had 2 different charts, and hopefully I didn't go too fast, but I hope this helps.